Assalamu alaikum wa rahmatullah. Good morning, everybody. Here is Dr. Bassam Salama from Naseem Rabeeh Medical Center, Rayyan, Doha. Welcome to the health tips of today. We will talk today about heart attack. To facilitate it for the audience and the observers, let us do it in terms of questions and answers. First, what is heart attack? Heart attack is a situation in which the blood supply to the coronary arteries is compromised, either by narrowing of the coronary blood vessels or by the presence of plaque or atheroma, which is simply a fat accumulating in the blood vessels. The signs and symptoms of heart attack: usually there is a history of a middle-aged patient with a chest pain. This chest pain is described by the patient as the most severe pain that he has ever experienced in his life. This chest pain is usually behind the sternum. The pain may radiate to the left shoulder or to the left arm, and it may also radiate to the neck. This pain could be stabbing, could be compressing, and this pain is not alleviated by any medications. So this pain is associated with the patient being pale, cool, and clammy. Pale, it means his color is not normal. The normal color is pink. Pale is like the color of the hand. If you press, then it becomes pale. Okay? Cool, usually the patient who has stress or exercise, he gets warmer. The patient who is having a heart attack, he gets cool. And there is a sweat in the front. This sweat is called cold sweat. Logically, if you make some exercise, you will have some sweat. But if you are at rest and you have such type of sweat, this is a sign of heart attack. There are risk factors for the heart attack that we should avoid so that we can prevent the heart attack. These risk factors include: number 1, smoking tobacco; number 2, hypertension; number 3, diabetes mellitus; number 4, stress; number 5, having too much cholesterol in the blood. In order to avoid such factors, we have to change the lifestyle. We have to make exercise every day. Simply, I advise everybody to park his vehicle 15 minutes away from the gate of his home, so he can walk at least 1 hour per day. Changing the type of nutrition, avoiding the picnics and takeaway food is very important. Also, making exercise or aerobics will be very helpful. You should avoid smoking, and if you have hypertension, you should get your blood pressure controlled. If you have high blood cholesterol, you should have the proper treatment by the doctor. If you have your blood sugar elevated, you should get it controlled by anti-hyperglycemic medications. During the attack, what should you do to help a friend of yours or member of your family to alleviate his pain and to help the doctors in the hospitals when he reaches to the emergency? First of all, you have to give the patient 3 tablets of baby aspirin or pediatric aspirin, which is 300 milligrams. You advise the patient to chew them thoroughly. Second, allow fresh air. Third, don't let the patient sleep or be in the recumbent position. He should be transported to the hospital while sitting, because this will help to make venous pooling and the blood will not accumulate back on the heart, which is having a trouble at that moment of time. If the patient is having antihypertensive medication or anti-angina medication, you should provide him with such medications. For example, Izordil 5 milligram sublingual. And when the patient reaches to the hospital, he should be managed by the doctors, he should have ECG, and then they will manage accordingly. So this is a summary about heart attack, and I have few tips for you to be healthy. These 7 piece of advice, the golden piece of advice, will keep you healthy and will prevent heart attack from happening in the future. Number 1, walk for 1 hour per day and take 1 tablet of baby aspirin. Number 2, eat 2 apples per day. Number 3, eat small 3 onions per day. Number 4, drink 4 liters per day of water. Number 5, eat 5 small grains of garlic every day. Number 6, take 6 spoons of olive oil per day. Number 7, eat 7 dates per day. I hope that if you follow this regime, you will never have a heart attack. For any questions or any concern, please visit our branch at Rayyan. We have a team of doctors who are ready to help you any moment of time, to answer all your questions and to do the necessary investigations and screening for you and all members of your family to keep you healthy. Thank you very much and goodbye.